there, is your name Joel?
Yeah.
Hi, my name's Natalia. I'm a nurse practitioner student, and I'm here to do a physical examination on your knee today, if that's okay with you.
Yeah, that's okay with me.
Great, so I'm going to be taking a look at both of your knees, both of your hips, and your ankles, and I might be poking around a little bit. If anything feels uncomfortable at any point, just let me know and I can stop.
Yeah, will do.
Okay, just going to sanitize my hands. So for the purposes of this video, we will not be going through the examination of the hips and the ankles, but we will just focus on the knee. So first, I'm going to start with inspection. So I'm going to be looking at both knees bilaterally, and I'm looking for any swelling, any erythema or redness, any muscle atrophy. Really important to compare both sides here. Any skin changes such as ecchymosis and any deformities. So Joel, if you could stand up for me and turn around. It's also really important to assess the knees posteriorly as well. So again, I'm looking for the same things posteriorly, especially noting any masses, any redness, erythema, or ecchymosis. So next, we're going to proceed with palpation. For the purposes of this video, we're only going to palpate one extremity, but in practice, we would be palpating both limbs for comparison. So in palpating the lower extremity, we're going to be looking for any tenderness, any effusion or swelling, any temperature changes, especially warmth, any crepitus with movement, any muscle atrophy, and we're also going to be palpating for pulses. So first, we're going to start with palpation of the quadriceps. And coming down to the quadricep tendon, we're also going to palpate the medial and lateral epicondyles of the femur, and also the medial and lateral joint lines where the medial and lateral collateral ligaments lie. Coming back to the patella, we're going to palpate down towards the patellar tendon to the tibial tuberosity, and we're also going to palpate the medial and lateral condyles of the tibia. We'll then proceed to palpating the tibia, the gastrocnemius, and then if you could stand up for me and turn around, we're also going to palpate posteriorly in the popliteal region, and while we're palpating posteriorly, it's also important to palpate the popliteal pulse. And we would also be palpating the pedal pulses, including the posterior tibialis. So next, we're going to assess the range of motion of the knee. So we'll do this first passively and then actively. So while I am passively assessing the range of motion of the knee, I'm going to place my hand on the knee and feel for any crepitus. I'm also going to be looking for the smoothness of the movement and any reduced range of motion. So first, we're going to flex the knee and extend. Good. Now, Joel, can you do that same movement again?
Yeah.
Next, we're going to assess the strength of the knee joint. So in doing this, we're going to compare the strength of the knees bilaterally and make sure that they are equal in strength. We're also going to be assessing for any pain during these movements. So Joel, I'm just going to bring your knee up, and I want you to push against my hand. Good. Now I want you to pull your ankle back towards your body. So next we're going to assess sensation of the lower limb. So Joel, I'm going to touch your leg with the end of this reflex hammer, and every time I do, it's going to feel like this. And every time you feel that, I'd like you to say yes, okay?
Mm-hmm.
Okay, so close your eyes.
Yep. 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 Yep.
Great. So next we're going to do a few special tests to assess for tears in the ligaments of the knee. So we're going to start with the anterior drawer test. And in doing this, we're going to assess for any tears of the anterior cruciate ligament. So what I'm going to do is I'm going to pull anteriorly on the tibia, and a positive test would have, in a positive test, I would see the tibia slide forward anteriorly. Next, we're going to assess for any posterior cruciate ligament tears. And to do this, we're going to assess with the posterior drawer test. So when doing this, I'm going to push posteriorly on the tibia. A positive test, we would see the tibia sliding backwards or posteriorly. So next, we're going to assess the medial and lateral collateral ligaments with the valgus and varus test. So I'm going to start with the valgus test. So I'm going to flex the knee and I'm going to place stress on the medial collateral ligament. And I'm looking for any laxity here, which would indicate a positive test and a medial collateral ligament tear. Next, we're going to assess the lateral collateral ligament with a varus test. So I'm going to place stress on the lateral collateral ligament, and laxity here would indicate a positive test and a lateral collateral ligament tear. Okay, so next we're going to assess for any effusions within the knee. So first we're going to compress the suprapatellar pouch against the femur and also apply pressure below the knee, and we're going to look for any ballooning within the knee. And then we're going to do the ballottement test by tapping the patella and looking for any bouncing of the patella. So next we're going to assess for any meniscal tears, and we're going to do this with the McMurray's test. So in order to do this test, we're going to flex the knee. We're going to externally rotate the tibia and then flex and extend multiple times, looking for the smoothness of the range of motion and also looking for any painful pops or clicks. Next, we're going to internally rotate the tibia and do the same thing. Again, looking for smoothness of range of motion or any painful pops or clicks. So Joel, next I'd like you to try and do a squat for me. So in doing this, please let me know if you're feeling any pain, or if you're unable to do it, that's okay too. So I'd like you to just take a wide stance and do a squat like this. Great. So next we're going to assess the patient's gait, and in doing this we're going to be looking at alignment, the smoothness of the gait, as well as heel to toe striking. Joel, if you could just take a walk across the room and back. So next we're going to assess deep tendon reflexes, and we're going to do the patellar tendon reflex. So just relax, Joel.